After watching the needs and challenges of disasters video, there are a few questions that we are responding to. Question number one: what are the needs and challenges of the heroic phase? The heroic phase occurs immediately after disaster. It is characterized by high energy and adrenaline as individuals and community engage in rescue and survival efforts. The needs and challenges during this phase includes during this time of the heroic phase, the individuals have a lot of energy. They're always like, yes, let's go do it. I'm not whatever you need, I'm there for you. The challenges and needs that may occur is the immediate safety and security. So ensuring safety of the survivors and preventing further harm is critical. This can include search and rescue operations, providing shelter and securing the disaster area. Number two, basic necessities. Access to food, water, medical care, and shelter is essential. The challenge lies in the swift mobilizing and distributing these resources amidst the potential chaos and infrastructure damage. Number three, coordination and communication. Having effective coordination and communication among first responders, volunteers, and relief organizations is crucial. Communication breakdowns can hinder rescue and efforts and resource distributions. Four, having emotional support. Providing psychological first aid to individuals to cope with the shock and trauma is important. Trained medical professionals and volunteers can offer immediate emotional support. It's also crucial that you have your crisis counselors on hand to provide that emotional support with those victims that are experiencing trauma crisis at that moment. Question number two: the honeymoon phase can include a crash point. Describe who, when, and why this may occur. The honeymoon phase typically follows the heroic phase. This can last for weeks to months. It is characterized by a sense of optimism and strong community cohesion as survivors experience relief from immediate threat and are grateful for the support that they have received. However, they do experience a crash point during the stage. So who can be affected by this crash point? Both the individuals and communities may experience this crash. Those who are actively involved in the immediate response of those who are facing the reality and the losses particularly vulnerable to these certain crash points. When? So after you have your heroic phase, everybody's high energy, all about the survival. Then you might come in where you have weeks to a few months after the disaster. It's like the optimism or the adrenaline has wore off. And now the long term reality of the recovery sets in when you see how long it's going to take for everything to be clean, or if the situation is they may lose their home. Why? The initial surge of support and social media tension is kind of deplenished, leaving the survivors to face the extensive and often slow in recovery process. Individuals may feel abandoned, frustrated with the process, or they realize these tasks of rebuilding their homes or any kind of infrastructures, it may contribute to this crash point also. This is when individuals and the people who are coming to volunteer, they both can experience a crash point. Our third question: during the disillusionment phase, fear and anger and hopelessness can set in. What types of clinical conditions may develop for those circumstances, and what type of treatment is best to overcome them? So after you have your heroic phase, then you might go through your honeymoon, your crash point, and then your phase after the honeymoon, this disillusionment phase that follows. And this one can last anywhere from months to years. So during this phase, survivors may experience a sense of abandonment and frustration as they confront the ongoing challenges of recovery. These phase is marked by a lot of people may experience fear, anger, and hopelessness. So survivors may feel overwhelmed by the slow process or their needs not being met or the lack of support. So due to that, they may lead to these clinical conditions such as depression, which is persistent sadness, a loss of interest in activities, or feeling a sense of hopelessness. You can also develop anxiety disorders where they have excessive worry, fear, and hypervigilance. Um, Survivors can also experience post post traumatic stress disorders, PTSD, where they re experience the trauma, they have avoidance behavior or a heightened sense of arousal. And some individuals also may use substance, they may have a substance abuse disorder, which they rely on drugs or alcohol as a coping mechanism. Um, to combat that, we do have types of treatments that would be effective to use. So you have cognitive behavioral therapy, which is one type of therapy that people could use, which helps individuals identify and modify negative thoughts and behavior patterns. You also have trauma focused therapy, such as the eye movement desensitization and reprocessing to help traumatic memories. This is very effective for individuals who have PTSD, who are constantly re experiencing that trauma over and over again. This is a good form of therapy that I would recommend for those individuals. Um, Another type of treatment that would be very effective is support groups, which provide space for survivors to share their experiences and also to have support from those who may have experienced the same type of trauma to help them have some type of individual to rely on, or they can share how they feel. Um, when individuals who may have extreme cases of depression or anxiety, medication could also be used to help manage the symptoms of depression or anxiety. Um, and then another recommendation that I would do for types of treatment is a community-based intervention, since those communities who are greatly affected by that crisis, I would do the programs to help rebuild communities, connections, and provide social support, and also have that sense of belonging and purpose amongst the community um, in the area. In conclusion, understanding the different types of phases following a disaster and the unique needs and challenges associated with each phase is crucial for effective crisis intervention and support. Providing timely and appropriate mental health services can significantly aid in recovery and resilience in communities affected by this disaster. I have included the following resources in my response: the Needs and Challenges of Disaster video, Fundamentals of Crisis Counseling book by Miller, The Treatment, Trauma, and Christian Counseling by Generich, and then Following Disasters by Carr. It's a journal article. Thank you.